When we talk about kidney problems, what's the first thing that comes to your mind? High creatinine on a blood test, a puffy face in the morning, foamy urine. But what if I told you that long before any blood test raises a red flag, long before your creatinine climbs and your doctor makes that worried face, your own foot is already trying to warn you that your kidneys are calling for help? Most people, especially after 50, look down and see a swollen foot, dry skin, a toenail changing color, and blame it on the heat, on aging, on tight shoes, on poor circulation. They soak their feet, prop them up, take an aspirin, and figure it will pass. And unfortunately, by the time they discover it was the kidney sending signals through the foot, the situation has already gone too far. Today I'm going to reveal the 7 signs your foot gives you when your kidneys are starting to fail. These are everyday things you see every time you take off your shoes, every time you look down, and that most people ignore simply because they don't know what they're looking at. And pay close attention, because when we get to sign number 3, you'll understand why that maddening itch that appears on your feet and shins without any insect bite whatsoever could be your kidney screaming that it's suffocating from the inside. And at the end of this video, I'll reveal a simple, inexpensive blood test that most doctors don't order routinely, but that can catch kidney problems years before creatinine rises. This information could completely change the trajectory of your kidney health. I'm Dr. James Carter, over 20 years of clinical practice. Let's begin. But first, to lose the fear, we need to understand the enemy. Your kidneys are 2 blood filtering machines the size of a closed fist, hidden in your back. They work 24 hours a day, 7 days a week, filtering approximately 180 liters of blood every day. That's like running a small swimming pool through a filter every 24 hours. What do these filters do? They separate what's useful from what's waste. Clean water, balanced minerals, purified blood goes back to the body. Waste, toxins, excess salt, and fluid get sent out through urine. It's a job of extraordinary precision that happens non-stop. No days off, no complaints. But when those filters start to clog, when chronic kidney disease begins settling in silently, the body starts accumulating what should have been eliminated. Too much fluid, too many toxins, minerals out of balance. And do you know where that excess goes first? To the lowest part of the body. Gravity pulls it down. And what's lowest? Your feet. That's why the foot is the first messenger. Not because the kidney lives in the foot, but because the foot is the lowest point in the system. It's where accumulation shows up first, before the face, before the hands, before anywhere else. The foot is the drain of the body. If the plumbing is clogging, it's at the drain where the problem appears first. Let's go through the 7 signs, from 7th to 1st, from most subtle to most urgent. The 7th sign, the foot that stays ice cold all the time. You go to bed at night and your foot is cold as a stone. You put on socks, thick socks, tuck it under the blanket, and still it won't warm up. People say, oh, it's poor circulation, it's aging. Not necessarily. Here's what may actually be happening. When kidneys start to fail, they produce less of a hormone called erythropoietin. This hormone is responsible for telling the bone marrow to manufacture red blood cells. Red blood cells are the little trucks that carry oxygen to every corner of your body. If the kidney produces less erythropoietin, the marrow makes fewer red blood cells. Result, anemia. And the first place that feels the lack of oxygen and warmth in the blood? The extremities, the feet. It's the same principle as when your hands get cold in winter. The body prioritizes vital organs and abandons the extremities. But here it's not external cold. It's the kidney that stopped ordering the oxygen trucks. The foot goes cold from the inside. If your feet are perpetually cold, even in warm weather, and especially if this came along with fatigue, weakness, and paleness, it's not just circulation. It could be the kidney sending its first warning through the temperature of your foot. And right here I need to stop, because what I'm showing you is not theory. These are signs I see in my practice every week. Patients who spent years thinking they had poor circulation and dry skin, when in reality their kidneys had been calling for help for a long time. And the connection most people miss, kidney health and cardiovascular health are inseparable. The kidneys filter your blood. When they deteriorate, the blood becomes toxic. Toxic blood damages the heart and blood vessels. Damaged vessels deliver less blood to the kidneys, a devastating spiral where each system drags the other down. The cold feet, the swelling, the toxin buildup, all of it accelerates when the cardiovascular system can't support the kidneys properly. This is exactly why CardioShield is critically relevant to kidney health. This natural formula with hawthorn leaf, olive leaf extract, green tea, and garlic supports the cardiovascular system your kidneys depend on. Hawthorn leaf strengthening the heart that needs to pump adequate blood to the kidneys for proper filtration, the same filtration that prevents the toxin buildup causing every sign on this list. Olive leaf extract fighting the chronic inflammation that silently destroys kidney tissue year after year. Green tea providing the antioxidant defense that protects nephrons from oxidative damage. Garlic maintaining healthy blood flow and blood pressure, the two most critical factors for kidney preservation. I can only help the first 5 people who act now. More than 200 people have already experienced the difference. Doctor, I had cold feet and swelling for 2 years. Nobody investigated kidneys. After starting the right approach with CardioShield, my nephrologist said my kidney function actually stabilized for the first time. They call it a miracle product. Link in the first pinned comment. 180-day guarantee. 0 risk. Disclaimer, not a substitute for medical care. The 6th sign, skin on the foot that becomes dry, flaking, and rough as sandpaper. You apply cream, moisturizer, petroleum jelly, and 2 days later the foot is parched again. Cracked heels, peeling on top, white skin flaking off like dandruff from the foot. Most people think it's lack of hydration or a fungal infection. They buy antifungal cream, use it for weeks, and nothing improves. What's actually happening is different. When kidneys aren't filtering properly, they can't maintain the balance of minerals in the blood. Calcium and phosphorus become dysregulated, and this imbalance manifests in the skin, especially at the extremities. The skin loses its ability to retain moisture. It becomes dry, rough, with a texture like aged paper. Additionally, urea that should be leaving through urine starts accumulating in the blood, and when urea gets too high, the body tries to eliminate it through sweat and skin. The skin of the feet, which is already the thickest on the body, suffers first. It takes on that sandpaper texture that no cream resolves. Because the problem isn't in the skin, it's in the filter that isn't cleaning the blood properly. The 5th sign, foot swelling that leaves a dent when you press. You press the skin on the top of your foot or ankle with your thumb, and a deep pit remains that takes several seconds to bounce back. Like pressing bread dough. This has a medical name. Pitting edema. This swelling isn't just fluid accumulation from standing too long. When it's renal, it has specific characteristics. First, it's bilateral. It appears in both feet simultaneously, almost symmetrical. Second, it worsens throughout the day with gravity and improves somewhat in the morning after sleeping. Third, when more advanced, it climbs from the shin to the ankle to the foot, and the shoe that fit last week no longer fits today. The weakened kidneys can't eliminate sodium and fluid adequately. The body retains what should have been eliminated. Gravity pulls everything down, and the foot swells like a waterlogged sponge. Many people see a vascular specialist thinking it's varicose veins. The specialist examines, does an ultrasound, finds nothing serious in the veins, and says, "Everything's fine, just fluid retention." The person goes home relieved, but nobody ordered a kidney function test, and the kidney keeps deteriorating in silence. The 4th sign, cramps that attack the feet and calves, especially at 3 a.m., 3 in the morning. You're sleeping peacefully and suddenly a monstrous cramp locks your foot or calf. Pain that makes you jump out of bed, pace the room, massage desperately until it passes. And this happens several times a week. Most people think, low magnesium, low potassium, need to eat more bananas. Could be. But when cramps are frequent, intense, and accompanied by other signs from this list, the cause may be renal. Diseased kidneys don't regulate electrolytes properly. Calcium, magnesium, potassium, and phosphorus all become imbalanced. And muscles need these minerals in exact proportions to function. When the balance breaks, the muscle spasms, contracts, and won't release. And since feet and calves are the muscles furthest from the heart and most dependent on fine mineral balance, they're the first to malfunction. And here I cannot continue without interrupting. Because the electrolyte imbalance that causes the cramps and the fluid retention that causes the swelling and the toxin buildup that causes the dry skin all depend on one thing: blood that flows properly through the kidneys at the right pressure. And that is what CardioShield supports. The cramps won't stop if the kidneys can't balance minerals. The kidneys can't balance minerals if blood flow is inadequate. Blood flow is inadequate when the cardiovascular system is struggling. CardioShield supports every link in that chain. Hawthorn for cardiac output, olive leaf for inflammation that damages nephrons, green tea for oxidative protection, garlic for blood pressure and flow. More than 200 people. Doctor, my nighttime cramps that I'd had for 3 years stopped within 6 weeks of addressing both the kidney nutrition and the cardiovascular support. My nephrologist reduced my potassium supplement because my levels normalized. Miracle product. Only 5 first people. Link in first pinned comment. 180-day guarantee. 0 risk. The third sign. Maddening itch on feet and shins with no explanation. This is the sign that deceives the most. The person scratches their feet, scratches their shins, scratches so hard they sometimes break the skin until it bleeds. Goes to the dermatologist. It's dermatitis, it's allergies, it's dry skin. Gets prescribed cortisone cream, moisturizer, antihistamines. Improves for a few days and comes back with a vengeance. What may actually be causing this itch? Uremia. When kidneys don't filter properly, urea accumulates in the blood. High blood urea is like the body being submerged in an internal bath of toxins. And the skin, which is the body's largest organ and functions as an emergency excretory organ, tries to expel these toxins. Result: irritation, itching, that sensation of something under the skin that bothers constantly. There's even a medical name for this: uremic pruritus. It's one of the most common complaints in patients with moderate to advanced chronic kidney disease. And the cruel detail is that this itch can begin years before the person is diagnosed, because kidneys can lose up to 50% of function without creatinine rising significantly on blood tests. Another cause of renal itching: the calcium-phosphorus imbalance mentioned earlier. When phosphorus accumulates too much in the blood because the kidney can't eliminate it, it deposits in the skin as microscopic crystals. These crystals irritate the skin's nerves. It's like having thousands of tiny grains of sand pricking from beneath the skin. If your itch has no explanation, doesn't respond to dermatological treatment, and concentrates especially on feet, shins, and back, ask your doctor for a kidney function test. It might be the answer nobody has given you yet. The second sign: toenails changing color, becoming whitish, or developing a dark band at the tip. Look down right now. Look at your toenails. Healthy nails are pink and uniform. When kidneys are failing, visible changes occur in the nails. One of the best known is called half and half nails, or Lindsay's nails. The bottom half of the nail turns whitish, pale as paper, and the top half develops a dark brown or reddish band. The dividing line is sharp. This happens because of toxin retention and anemia. The white part reflects the pallor of anemia and altered vascularization. The dark band is melanin deposited due to accumulation of uremic toxins. Not everyone with kidney problems will have exactly this pattern, but any change in toenails that isn't fungus confirmed by laboratory testing deserves attention. Nails that have become more brittle, more opaque, with deep ridges or unusual colors are the body writing in a language most people can't read. And finally, the first sign, the most urgent of all. The first sign: numbness and tingling that climb from the foot toward the shin. This is the sign that makes me sit the patient down, look them in the eye, and say, we need to investigate right now. Because when numbness arrives, it means the damage is advancing into dangerous territory. It starts in the toes, a subtle numbness, as if there were an invisible sock between your skin and the world. Then the tingling climbs to the sole, then the side, then the shin. The person gradually loses sensation, can't feel the temperature of water in the shower, trips because they can't feel the ground properly, and most dangerously, gets a wound on the foot and doesn't notice. That wound can become infected without the person ever feeling pain. This is called uremic neuropathy. The toxins that the kidneys are no longer filtering are destroying the protective coating of the nerves. The longest nerves in the body, the ones that reach all the way to the feet, are the first to be damaged. Because they're the most distant, the thinnest, the most vulnerable. If you're experiencing numbness or tingling in your feet that doesn't go away, especially if it's progressive, if it's been climbing over time, do not wait. Request a kidney function test this week. Now that test I promised at the beginning. The test most doctors don't order routinely, but that can catch the problem years before. The name is urine albumin to creatinine ratio, or simply microalbuminuria. It's a simple, inexpensive urine test that detects microscopic amounts of a protein called albumin leaking through the kidneys. When kidney filters are perfect, albumin does not pass through. It's too large to cross the filter mesh. But when the filters begin to deteriorate, the first albumin molecules start to escape, like a sieve that starts developing tiny holes before it tears apart. Blood creatinine can be completely normal while albumin is already leaking in the urine. It's like a bucket with a small hole at the bottom. The water level may look fine, but the bucket is losing water drop by drop. When the level finally drops noticeably, the hole is already big. Microalbuminuria catches the small hole. High creatinine catches the big hole. Which would you rather discover first? How many of these signs did you recognize? If you recognized one, that's already reason to talk to your doctor at your next appointment and request complete kidney function testing. If you recognize 2 or 3 together, don't wait for your next appointment. Schedule this week. If you identified 4 or more, go to the emergency room and request urgent kidney evaluation. Do not normalize these signs. Kidneys lose function in silence. When a patient arrives with high creatinine, they've usually already lost more than 50% of their filters. And what's lost doesn't come back. But what still works can be protected. Everything I taught you, the 7 signs, the test, the mechanism, all of it depends on one critical foundation: a cardiovascular system that delivers what kidneys need. Blood flowing at the right pressure through flexible vessels to nephrons that need oxygen and nutrients to filter properly. When the cardiovascular system fails the kidneys fail the body. CardioShield supports that foundation 24/7. Hawthorn leaf for the heart pumping blood to every nephron. Olive leaf for the inflammation-destroying kidney tissue. Green tea for oxidative protection. Garlic for blood pressure and flow. These aren't random ingredients. They are the exact cardiovascular mechanisms that determine whether your kidneys survive or fail. More than 200 people. Nephrologists impressed. Kidney function stabilized. Miracle product. Link in first pinned comment. 180-day guarantee. 0 risk. Your kidneys have been working for you every second of your life without a single day off. They deserve support. And it starts with looking down at your feet. 3 golden rules to protect your kidneys starting today. First, reduce salt. Sodium is the #1 enemy of weakened kidneys. Every gram less is relief for your filters. Learn to use herbs, garlic, onion, lemon for flavor. Second, drink water intelligently, not chugging 2 liters at once. Small sips spread throughout the day. Kidneys work better with steady flow than with floods. Think of a river. Calm, continuous flow keeps the bed clean. Floods cause erosion. Third, control blood pressure and blood sugar. Hypertension and diabetes are the 2 biggest causes of kidney disease. Together they account for over 60% of dialysis cases. If you have high blood pressure or diabetes, take your medications every single day without skipping. These 2 villains destroy kidney filters drop by drop, day by day, without you feeling anything until it's too late. Your kidneys are 2 miraculous machines that work non-stop for you since before you were born. They never take a day off. They never complain. They never stop until they can't go on. And when they start calling for help, they do it in the most discreet way possible. They send the message to your foot, hoping someone will look down and understand. Today I taught you to read those messages. Now the responsibility is yours. Look at your feet. Look at the feet of the people you love. One attentive look could be the difference between protected kidneys and a dialysis machine. Share this video with someone you love, a parent, a neighbor, a friend who has swollen feet and thinks it's just the heat. This information could save someone's kidneys today. Take care of your kidneys. They take care of you every day of your life. I'm Dr. James Carter.